Hello, everybody. Welcome to Applying Humanism, Client-Centered Theory to Social Work Practice. This presentation is a result of a collaborative effort between Stephanie Conlee, Brianna Jimenez, Danielle Kruger, and myself, Tiamoya Johnson. As discussed in the Langer and Leeds book, there are three principles of the client-centered theory. First, personal and social problems occur when people are devalued. Client problems occur when they feel devalued and when they lack power and control over their lives. This can cause problems in self-image, relationships, and mental health. Social workers promote dignity and self-worth to clients in order to put a stop to oppressive treatment that the client may be experiencing. Social workers also can increase client self-determination by finding ways that clients can make choices within their lives. The second principle is that change happens in the context of an authentic helping relationship. Change in clients is fostered through unconditional positive regard, empathy, and a non-hierarchical model that does not assume that the social worker is the expert. Client-centered theory focuses on building therapeutic rapport by validating the importance of a person and creating an open and safe place for the client to work through his or her problems. The third principle is people are capable of self-actualization when the conditions allow positive growth and change. People are naturally inclined toward growth and change. Self-actualization is a process that allows individuals to grow and embrace and value their existence. A social worker's responsibility is to create conditions that can facilitate growth and not to solve the client's problems. Many of the values that are expressed in client-centered theory are fundamental to social work practice. According to Turner, one of the basic beliefs of humanism is that human nature is positive, meaning that humans are growth-oriented and forward-moving. This belief assumes that if people were not forced into socially constructed molds, but are accepted for who they are, then they will turn out good and act in ways that enhance themselves and society. The micro level is the most effective setting for implementing client-centered therapy. It fosters an environment of greater openness and trust, leading to a more comfortable setting that allows for a better therapist-client relationship to form. Client-centered theory can be implemented in a number of settings, such as the client's home, a park, a library conference room, or the therapist's office, somewhere in which the client can feel at ease and be able to form a positive relationship between self and therapist, and that also provides the best conditions of anonymity. The meso setting is the largest effective platform in which the humanistic, client-centered approach can be realistically employed. These groups can include refugee populations from the same region, indigenous tribes, veterans groups, etc. In this setting, groups of persons who are from the same cultural, religious, ethnic, or minority background can engage with one another as well as the therapist in a non-hierarchical setting. This allows the individuals to voice positive reflection and constructive commentary regarding their group, both as a group and as individual members of that group. Client-centered social settings on a meso level can include a community meal or potluck, cultural community center, and tribal centers. There are multiple strengths and limitations of client-centered theory. In relation to strengths, client-centered theory closely adheres to tenets of social work values, including the importance of human relationships as well as the dignity and worth of a person. Client-centered theory creates a psychological environment that releases, frees, and utilizes deep strengths in the client. It also facilitates client self-determination and choice. Client-centered theory informs all levels of social work practice, including micro, meso, and macro levels. Client-centered theory is also applicable in multicultural settings. In regard to limitations, client growth and change is heavily dependent upon the professional's ability to establish a trusting client-therapist relationship. In Chapter 1 of the Langer and Leeds text, we learned the field of social work has become concerned that professional decision-making is not just grounded in theory, but also supported by empirical evidence. The field of social work suggests choosing interventions based on the best available evidence of effectiveness. Langer and Leach state that the client-centered theory has not been established as an empirically supported treatment. Studies of the client-centered theory have focused on determining the importance of the therapeutic alliance and the common factors across many settings versus examining the effectiveness of specific interventions typically studied for fit of empirically supported criteria. This makes the theory a broad application and not narrow enough to study. Another limitation of the client-centered theory is that the theory is considered simplistic. According to Langer and Leitz, this theory takes a non-directive approach which leaves social workers with few guidelines for treatment. This theory requires social workers to be in the moment and be prepared for any content brought on by the client. Lastly, the client-centered theory is grounded in the development of genuine professional relationships in order to foster growth and change. This may take a social worker time to establish the type of rapport recommended in this theory. In today's world, managed care shrinking resources can limit the amount of time social workers can directly meet with the client. This reduction in time does not allow a social worker the amount of time needed to establish the kind of rapport recommended in this theory.